Hey everybody, I am here with Dr. Brandy Wiltermuth over at ThreeHealth. You can find them at 3.health. And so we're here to talk about their treatments for weight loss along with some of the common questions and things that patients are wondering about. So doctor, thanks so much for joining us today. Really appreciate it.
Okay, first I have to correct you. I'm not a doctor. I'm a nurse practitioner, but
Sorry about that.
that mistake is very common. So
Okay.
thanks for having me. I'm glad to be here.
Yeah, definitely. Yeah, and I wanted to start off just by asking about, your experience working with these patients and what got you interested in working with them.
So I'm not like, not unlike a lot of people. I had my own conversion story, was struggling with some excess weight. And as a healthcare professional, I was a nurse and, I was confused about the message of just eat less and exercise more, because the more I did that, the more muscle I gained, but I didn't lose any weight. And so I guess I was getting fitter, but that wasn't my goal. And so I decided to go towards more of a preventative type medicine after my first nurse practitioner job was working in oncology in an outpatient setting. And I truly did not enjoy it. And so I was like, there's got to be something that I can do that's more preventative. And I found a practice that was practicing medical weight loss. And truly, I didn't know what I was getting into. I just knew I didn't want to do oncology anymore. And I wanted to work on the core issue, and so I started that. And that was 17 years ago, which is crazy. And I had really a good first experience at that clinic. It was a little bit kind of plug and play. So it wasn't a whole lot of like extreme decision making that I had to make and that sort of thing, but it got my interest in medical weight loss. And then I also, saw the effect of the, comorbidities dropping off as people lost weight. And I thought this is really important and really good, because I was also working in the hospital as a nurse and I was seeing the ravages of type 2 diabetes up close and personal every single day. And it just, it really sunk in, like we have to do something different. We have to, take a more preventative approach, and people don't really need to end up here with type 2 diabetes, having all these complications like amputations and blindness and dialysis, that we could do better before people got to that place. So I took a couple years and did mostly internal medicine, but I practiced weight management there too, because it goes hand in hand with all the chronic comorbid conditions that people come with. And then I decided that I was going to go back to strictly weight management. And that was in 2011. Ever since then, I've just been working in weight management in several different clinics. But now ThreeHealth is a clinic that me and my partners have started. And the reason why we formed it is because we couldn't necessarily find a way to work within facilities that offered us the ability to treat patients the way we wanted to. ThreeHealth stands for mind, body, spirit. And what was missing in most of those practices was the mind part. And, we believe that if people don't change their relationship with food and their behaviors around food, it's likely that they won't have long-term sustained weight loss and long-term success. So our ThreeHealth is founded on the fact that we aim for sustainable weight loss, and we want people to come and do it once and do it, really well, and not yo-yo on their weight and have to keep fighting that battle. And they will always need treatment because it's a chronic disease. But, our patients come to understand after a while that this is something that needs to be managed and it doesn't go away, just like most chronic diseases. So that's what we do here at ThreeHealth.
Awesome. Yeah, and I think there's a lot of patients that, are obviously looking to avoid a lot of those issues like diabetes and some of those other things there. But I think, like you mentioned too, they get frustrated with that idea of just exercising more and eating less. And they feel like at a certain point, they kind of they don't want to keep trying. They've done so many of those fad diets and, like you said, just really yo-yoing. So they're just not really seeing the benefit.
Yeah, I mean, people are really almost hopeless, when they come to us. And I think because we are a medical practice and not a commercial weight loss, we see people who have gotten to the point where they understand they need help. This is not just a willpower issue. It's not a personality problem. It's not, it's like these people are warriors. They've done everything and they just have decided like, okay, it's time for me to get some help with this because what I've been doing hasn't been working. And so we rarely get people who are like brand new to the concept of trying to lose weight. It happens, but not frequently. Most of our patients have been overweight their whole lives. They've struggled with weight at least most of their adulthood, for most people. And some of them have undergone really drastic, like you said, fad diets and really restrictive dietary interventions and even surgery and still are struggling. So we're kind of, I wouldn't say the last stop for a lot of people, but people get so frustrated they don't know where else to go. And those are mainly our patients.
Yeah, definitely. Well, it's at least good to hear that you guys have experience with those patients and you've been able to find out exactly what's going to work for them. What is the main difference between what you do and, somewhere that does something like bariatric surgery or one that just focuses on, kind of the traditional ideas of weight loss? Is it really just the education and everything, or what really sets you guys apart?
So I think the combination of the medical with the behavioral is really what sets us apart because I can do my best, I can give someone a perfect nutrition plan and they can follow it. But if they're just white knuckling and putting the blinders on and not going to any kind of social occasion and just, gutting it out to get to a certain point and not having a plan for what happens after that, or really realizing like it's not all or nothing. I have to find some flexibility. I have to learn what works for me. It's really just a process and depends on where people are and where they're starting. But in terms of nutrition information and knowledge, these people are pretty well aware. So from the medical perspective, we do a thorough evaluation, extensive blood tests looking for cardiometabolic issues, and then we use body composition as our target in terms of we look at body fat percentage versus BMI. So right away, people are really relieved because they don't have to meet the BMI recommendations for weight loss or that ideal weight. We try to get women under 32% body fat and men under 25% body fat. And usually that is a weight that they had been at some point and felt really good, but didn't think that it was the right weight because the BMI scale told them that they had to lose more. So, that's the major difference. We give people accurate goals based on health. And then we monitor those conditions that go along with obesity to make sure that we are indeed making people healthier as well as not losing muscle, because muscle is so, so important in maintaining weight loss long term. So I always tell my patients, let's not have a weight loss mindset. Let's have a bodybuilder mindset. And they kind of look at me funny and I say, I don't want you to do bodybuilding unless you want to, but bodybuilding means that you're going to focus on protein. You're not afraid of gaining muscle. You really want to eat regularly. You want to feel good and become healthier and a stronger person. And then they kind of go, oh, okay, well, I thought I was just going to get told to restrict and be depraved. And, here's pills to suppress your appetite and, what they've done before, which is a lot of times what happens at a commercial center.
Yeah, definitely. No, I think that's really important that you focus so much on the body composition rather than just losing as much weight as possible and even losing that muscle too.
Yeah. In fact, when we look at the medications that we use, I tell people right from the start that, the body composition is going to determine whether we get to increase doses and how we're going to transition through that increase, because I'm so determined to keep people from losing muscle through the process, because I've seen the ravages of that, and it just makes it extremely difficult for people to continue to maintain weight loss. So
Yeah, it definitely makes sense.
yeah.
So with medications like, semaglutide and Wegovy and those type of ones, I know a lot of patients have heard about that, kind of how those work. Is that something that you would use in your practice for those patients?
We do. My ideal patient is actually someone that has some of the comorbid conditions, because there is such a good response to that. And then, I have patients for long term. I have had patients for 8 years now, 9 years now, and I know them very intimately. They know me. We have a good relationship. We're very transparent about what we're trying to do here. And semaglutide in particular has been a very nice tool to have because, as you know, we haven't had any new weight loss drugs that have been approved for a really long time. And for most of my patients that have responded well to it, they had been plateaued. And, even over the last few years, which was really difficult for a lot of people gaining weight, even though they were getting treatment. So it's exciting to see a new tool, which it's not really a new drug, but it's a new tool in the weight loss space. And to see the response that people have to it rather quickly.
Yeah, absolutely. And how long do you typically find that, you need with patients to have it start working and for them to start seeing some results there?
It really depends on the patient. I mean, some of our patients who have had gastric bypass or gastric sleeve, they tend to require a little bit higher dose to get the effect of appetite suppression and the effect, I think, on the brain, that central effect on just reducing overall appetite and sensing fullness sooner. It's also kind of an anecdotal thing, but I can kind of estimate how well people are going to respond to a lower dose based on their baseline nausea. So if people walk around all the time and have some nausea, they tend to do better at lower doses, and we don't push them as quickly through the escalation. But it really is individualized, and I think that's key. If people are looking to use this medication, they really need someone that can go along with them and understand the effect of it. I think there's a lot of race to the top right now, and that's a little bit scary because I'm not sure what's happening to people's body composition, but where do you go from there? So those are some of the things that I think, like an obesity medicine specialist can help people with. Whereas if they're just kind of getting it online or whatever, sure, you can get the medication, but the medications are not magic. You still have to put the work into changing your eating and understanding hunger and satiety cues and all those sorts of things. But it is a very nice tool to have, I will say.
Yeah, that makes sense. And yeah, it makes sense that it's a tool as well, and it's something that you have to use in that process to be able to have a sustainable plan too. And it's not just, take it and lose the weight and then, make no changes, don't change any of the bad habits or anything too.
Which is, I think, the problem with, I don't think commercial weight loss centers are evil or anything, but their model is based on people not being successful and coming back. Right. And I guess we have a bad business model because that is not how we hope it goes. We hope people have success and then can sustain that weight loss long term, and we'll be here for them if they need us. But really, it's important to make people healthier overall. And I'm just not sure some clinics out there have that in mind.
Yeah, definitely. And so you mentioned too, really the best candidates for it would be somebody with some of those comorbid conditions.
Yeah, I think that there's a gamut of people who are interested in this, and I think there's a lot of noise and attention being paid to it. I'm not sure how I would feel about prescribing it to somebody who had 10 pounds to lose and just wanted to look good on vacation. That doesn't happen in my practice that often, really. But yes, I think the bigger impact is when we see those A1C numbers drop, we see liver enzymes get better, we see blood pressure decrease, it's lowering overall cardiovascular risk, which most of our patients carry along with excess weight. And to see those get better, even without a tremendous amount of weight loss, is what really excites me. And we don't have, traditional appetite suppressants are not considered especially desirable to use in somebody with, say, hypertension, right? So there's a little bit of a limit there on how you can use those. Of course, semaglutide has its own contraindications, but in general, if my patients have been struggling away for years and years, and we're already using oral appetite suppressants like phentermine, and they've really just not gained any traction. It's really nice to have another tool in the toolbox.
Yeah, definitely. And so it's able to be used for some of those patients that maybe are not a good fit for something like phentermine.
Yes, I think that's one of the most uh, common uses that I employ it for. And people like phentermine and they appreciate it, but what I've seen is that they don't need it
Mhm.
as much with the introduction of semaglutide. And a lot of people will then confess or confide in me later that, I was feeling really dry mouth, or I was having a little bit of difficulty sleeping. And so there's definitely a subset of patients that were probably not enjoying taking phentermine, and this is a better option for them, even if they continue the phentermine intermittently, which is, an option for people.
Yeah. And are those side effects mainly because it's more of a stimulant than the semaglutide is?
Yeah, it has a stimulant effect, which is a side effect, not the effect that we're going for. Um, but it's tends to even out as people stay on the medication. It's not as disruptive, but there are some people that just never overcome those side effects.
Mhm.
And because we haven't had any better tools, they have stuck with it because it does work, um, and kind of accepted or learned how to deal with some of the side effects that come along. And
Yeah.
I also use, phendimetrazine, which is shorter acting, and dathlopropion, and I'll even use bupropion at times, and all the medications that we have, which are few. Um, so it just depends on the person, and I really need to get to understand what their um, issues are around food and their eating habits and what they're looking to achieve. And that helps us decide which medications and how we're going to utilize them in their treatment process.
Yeah, makes sense. And is there a certain amount of time that somebody is only allowed to be on the semaglutide for? Or are they able to pretty much take it for as long as they need it?
Well, the studies I think were pretty extensive in terms of years, but I think people are questioning whether they will need to be on it long term. And honestly, if you think of any other chronic disease that responds to a medication, you would say, well, logically, if you're responding well to this medication and is treating the chronic disease that doesn't go away, then yes, you most likely will need to be on this medication or a medication like it,
Mhm.
um, to maintain these results. But in my practice, I think, we negotiate with people about how to use medications, what's helpful for them. Some people want to taper down, which I recommend rather than just stopping the medication.
Yeah.
I think that's where the art, I think, of this kind of practice is most evident in terms of really working individually with the person and figuring out. I know that the drug manufacturers say once you're on it, you should stay on it. And I think that there's insurance implications about changing doses once the max dose is achieved.
Mhm.
So, there's some intricacies there that you have to take into account, but I really individualize it for each person. And I hope that we find an effective way to use it in a maintenance manner where it's not quite as rigorous, but I don't have a protocol for that as of yet.
Yeah, I think that will most likely be something that comes out too. And do you find that, I think with the longer that somebody stays on it too, it might even be better because I think they have more time to start working on some of those bad eating habits and starting to exercise a little bit more too, and really, get into that
Yeah.
what it's going to take to sustain it.
I think having a jump start like that and having more of an honest assessment of hunger and satiety cues is important for people to implement those lifestyle changes, which I don't really love that word, but you know, the changes that people are going to need to make. I also think that, like going back to what I said before, eating less and exercising more does work long term, but again, we want to do it in a healthy way that is sustainable. So sometimes the ideal plan isn't the plan because it's not something that people can keep doing. which this medication kind of falls under that category based on its cost and availability and, those sorts of things. So I guess it's kind of up in the air and I don't have a solid answer, but according to what I've seen in the treatment of obesity long-term, it's probably going to be a factor in maintenance as well as during the weight loss phase.
Yeah, definitely. And you mentioned that you're looking for something that is sustainable and something that, gives patients a bit of flexibility too. Do you
Mhm.
usually recommend any type of specific diet for them or workout protocol? Or are you really just looking at them individually and trying to figure out what's going to work best for them?
In general, we have sort of three different strategies that we use with people. Um, Usually it starts with something more like a mechanical eating plan, which means we prescribe the amount of protein based on the muscle mass.
Mhm.
We prescribe the amount of carbohydrate based on their blood work and how, evidence of insulin resistance, or if we can quantify how insulin resistant people are. And then making sure there's adequate calories with fat. So those levers, we can pull based on people's response and how they're feeling and the rate of weight loss that they're achieving. And really we focus on fat loss. So that's one strategy. We usually eventually end up with some intermittent fasting after people have a good set metabolism, they're not losing any muscle, and they're really not needing to eat as often. We can implement that. And then we do use strictly ketogenic diet plans as well, especially for people who, are just not getting the traction that they need on a less aggressive carb restriction. So those are the main three. But again, everybody's nutrition plan is a negotiation between what's ideal and what will they do long term. And the target changes because as people become more insulin sensitive, they can, use more carbohydrates and not have any negative impact from eating that.
Mhm.
So I like to tell people that it's never static and it's a moving bullseye, and we just have to keep, reiterating our plan and tweaking it based on how people are responding.
Mhm. Yeah, and I think most patients would be open to that too, as long as they feel like they're moving in the right direction too, and like they're making that progress there. So yeah,
Yeah.
that makes sense.
Behaviorally, I think is probably the more important thing. And although exercise is extremely important in maintaining weight loss, I don't really focus on it at first. I like people to focus on what they're going to do anyway, which is eating food. And, my theory is that we have all these tools and we really need to understand how those tools work for each person. And if you do all the tools at once, you don't know what's working and what's not working. And you end up having to keep using all the tools. So I feel like my job is to help people understand the tools, the power of the tool, and when and how to use it. And some we put back in the box because it's not the right time. And exercise is one of those that we usually save for a little bit later when people have lost a little weight, they're feeling good, they have good energy, and they're asking me, hey, should I start doing something?
Right.
And the biggest benefit I can see from that is really, besides cardiovascular fitness, the mental and emotional stress relief that comes from exercise in my practice is what I'm going for when we start increasing activity.
Yeah, yeah, absolutely. And then you said too that a lot of times when patients decide to come to see you, they've already, tried a lot of those different diets, different plans, and everything like that. When do you feel like somebody really should seek professional help and come see somebody like you?
Well, I think if people have had significant weight loss more than a couple times, or if you don't want to keep having that process, it just seems that people need to exhaust other resources before they make their way here. And I wish that wasn't the case. But really anybody that has any kind of, condition that is worsened or caused by excess body fat, we would love to help them.
Yeah, definitely. I agree. And what would be the best way for patients to get in contact with you guys there?
So our phone number is 425-606-0022. You can text us and you can go on our website, which is THREE.health, 3Health, and there's no .com on that. And we have lots of information on our website, ways to schedule free consults, evaluations if you're ready to get started. And it's just a pretty simple process, but tons of good information on there about our programs and what we offer.
Okay, awesome. Yeah, and those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're thinking about something like this?
I would say basically just don't lose hope. There's hope. There's something that we can do, even if you think you've tried everything, you haven't. And there's people out there like me that look at this as a disease process and not as a moral failing. And we can help you figure out how it's going to work for you long term.
Definitely. Yeah, I think that's good advice. All right. Well, awesome. Well, thank you so much for taking the time to talk to us today and share the education. I really appreciate that.
Thank you.